I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at another question of the week, and this one is, can a transgender woman on hormones donate blood? This question of the week was prompted by an earlier question of the week regarding trans males and their ability to donate blood while they were on testosterone. So for trans females, the simple answer is probably yes. My answers come from BloodWorks Northwest, but you'll want to check with your local blood donation center if this pertains to you. So here are 3 simple points to help us examine this question. Point number 1, all potential blood donors are carefully screened before their blood is even taken, and then their blood is screened before it is actually used in a patient. A potential donor must be 18 years of age, weigh at least 110 pounds, and pass the initial health screen. So on the day of donation, you must feel well, you must have a normal body temperature, blood pressure, and pulse, and you must have a normal hemoglobin level, which reflects the iron in your blood. Additionally, there are other requirements. Most medications do not affect blood donor eligibility, but you can't donate if you or your partner are on HIV therapy. If you are taking PrEP, there is a waiting period, as there is with the measles vaccine. There are some medical conditions which can exclude a donor or require specific clarification from the healthcare provider involved. So the diagnosis of HIV, hepatitis B, or hepatitis C, you cannot donate. If you are pregnant or recently pregnant, you can't donate unless you've had a 6-week waiting period after a pregnancy is concluded. Cancer requires a 1-year wait. Chronic fatigue syndrome, lupus, Crohn's disease, multiple sclerosis, inflammatory bowel disease, all of these fall into the it depends category. And of course, you cannot be under the influence of alcohol or other substances when you donate. In addition, you may be excluded from donation or have your donation delayed by a recent surgery if you have had a blood transfusion of somebody else's blood. Certain piercings or tattoo procedures could make it impossible for you to donate, but this depends on the type of procedure and where it was performed. If you have traveled to high-risk locations, such as countries with malaria, you may not be able to donate. The important thing is to check with your center about specific requirements that can apply to you. Point number 2, your blood undergoes further testing before it will ever be used in a patient. After the blood is donated, there are further tests to screen for the blood type and RH. Then there are screens for a variety of diseases, including HIV, hepatitis B and C, syphilis, West Nile virus, and Zika virus, and more depending on your location. Point number 3, all donors at BloodWorks Northwest get the same questionnaire. It used to be that certain whole groups of people were excluded, such as gay men or men who had sex with men. Now, everybody gets the same screening, and eligibility is determined on the basis of risk behaviors, not their grouping or identity. So risk factors that may require specific restrictions can include new or multiple sex partners in the last 3 months, and if so, anal sex during that 3-month window. So in general, a trans female on hormones will be able to donate blood unless she is on medications that would exclude anybody else, unless she has a medical condition that would exclude her from donating at all. Pardon my typo. So that would include HIV, recent transfusions, etc. And unless she has engaged in more risky sexual behavior, that is to say one or new partner or multiple partners over the prior 3 months. And if so, has she been engaging in anal sex? Those things could exclude her. But she would not be excluded simply on the basis of being trans and on hormones. Hope this information was helpful for you today. If so, please like this video, do subscribe to my channel, and tell your friends about it. Do you have a question that you'd like to have explored? Submit it to the comment section below. Thanks for watching, and I'll see you in the next video.